Yeah, it's a unique story because I got to know it from all sides of the table. So I'm a pediatric hospitalist. That means I take care of kids that are sick enough to be in the hospital. It also means I see those pain points well from my lens. What is it like to be the doctor that's showing up to meet with the patient every day for what's called that most important discussion? It's called rounds. When the doctor shows up, ideally is meeting with the patient, the nurse, the family of the patient, often an interpreter, and I would often feel what it was like to show up to an empty room or just have the patient and not have the family or have to find the nurse. So I felt that pain point of care coordination personally. But then I experienced it as a loved one. Over a long stretch, we had multiple parents in the hospital, and I was often across the country the person they would call when the doctors entered the room or ask the doctors to call me. And I spent meetings for months saying, I'm going to get a phone call between 7 a.m. at noon, and I'm going to have to drop what I'm doing to enter that conversation. I'm sitting in a Great Clips waiting room getting text that says, you're 4 away for your haircut, you're 3 away from your haircut, and realizing if they can respect my time enough to tell me when I can be there, or I can track my pizza, or I can do any of these things, why are we not doing that in healthcare? And so, aimed to solve that problem of getting all of the stakeholders in the room for that most important discussion with what we call time transparency, the same thing we expect from Domino's or DoorDash in healthcare.